And while we're getting ready, I think I would like you to join me in wishing Lori a happy birthday. She's here on her birthday, so happy birthday, Lori. Anthony, I'd like to start with a question for you. When did the media campaign for Let's Move run? How long does an ad council campaign like that typically run? And one of the critiques that one always hears about the public service campaigns is that they air at times of the day and week when there are very few people in the audience. So what can you tell us about placement of these messages?
Yes, so firstly, that campaign launched in 2010, right around the second anniversary of the Let's Move program. Unfortunately, it only ran for 2 years, and the work expired this past February due to lack of continued funding, which I know is always an issue and part of the challenge that we face every day around sustainability of some of these messages. A typical campaign for the Ad Council runs anywhere from 3 to 5 years, but many for much longer. We've had Smokey campaign for 60 plus years, our United Negro College Fund campaign for over 45 years. The obesity prevention messaging has been out there in various forms with various sponsors for about 10 years. But again, because of the difficulty in sustaining funding, we've had to divert resources and change who we've worked with. I wish we could have continued that program. We now currently work with National Institutes of Health on a different program with similar types of messaging, but that program is now through with funding and will no longer exist after this month. So a continued challenge. As far as the last question about when these ads and a lot of the messages appear, it's actually a misnomer. We have data that shows that 70% of all of our advertising appears in desirable day parts, so only 30% is in that overnight period. And we have very detailed information about the day parts, the placement. So the ads that you saw there appeared on shows like American Idol and Oprah and others. So we pride ourselves on getting good placement, and the media community understands that in order for this work to be effective, it needs to appear when the audience that we're trying to reach is actually watching.
So could I just follow up?
Sure.
So you say that the money's run out on the Let's Move campaign. I thought that most of the money for these PSAs were donated work of the advertising agencies and that the media time was donated. That's not the case.
That is the case, but there are actual costs to produce the materials which are paid for by our sponsoring organizations. So while $45 million in exposure was given for free, while all the creative input and all the strategic input was done for free, the actual cost to go out there and talk to consumers in research, the cost to hire a film crew to produce a 30-second commercial, there are hard costs associated with that. So the return on investment for an organization that supports a campaign like this is typically anywhere from 45 to 65 to 1 for the return that they get in the media. But there are actual costs that need to be incurred when working with a union film crew and things of that nature.
So I'll come back with
Sure.
another question. But Lori, those are very disturbing. That ad for Mountain Dew is very disturbing. Could you tell us how long that was actually, where it appeared, how long it was on, and how did it come to become banned? Could you tell us what happened to it?
Yeah, it was an ad that there were a series that were created by Tyler, the Creator, a rapper who did it, pitched it to Pepsi, and in an interview said that he was kind of surprised they went for the idea. The goat is the main character in the ad and does some wild and crazy things, I suppose. I haven't seen all of them. I've only seen that one. And they were only on YouTube as far as I know, and maybe, there are various different internet outlets where it may have appeared. The ad came to my attention through, I'm sure, an email that somebody sent me, just the way we get our information these days, right? And it came to, I think, broad attention because of a blogger who posted a blog about it, and I believe the the blog was either in Adweek or reported on Adweek, and I apologize, I'm not remembering the blogger's name at the moment, but he titled his post, "The Most Racist Ad in History." So naturally that caught my attention, and then it was, so I went and looked at it, and then there's been quite a bit of discussion online about it.
But it's not available any longer.
Not as far as I know. Pepsi pulled it down.
And is the multiracial ad still on the Cheerios site?
I believe the ad is still on the Cheerios site, and the ad actually also ran on TV. And the ad, I think, is still on Cheerios site, but they just shut down the comments portion of the ad. I mean, the comments on YouTube, you know how people can leave YouTube, and YouTube is sort of famous for having some of the worst comments in that regard. And an interesting thing to think about, too, in the juxtaposition of those two ads is that the first one was targeted at the user, at the young people themselves. The second ad wasn't targeted at young people. The second ad was targeted to parents. And it's a very precise distinction that advertisers make when they're looking for ad parts and they want to get a particular audience. But when we're thinking about the message environment broadly, I think those distinctions are less useful. I mean, kids see lots of ads that aren't targeted to them. So, for example, when a Coca-Cola cup is on the counter during American Idol, that's not considered a kid-focused ad, even though there are more kids in that audience than there are in an audience for SpongeBob, which would be considered a kid-focused ad.
I would like to turn attention a little bit towards research. So, Anthony, I want to ask you first, has there been research that looks at how to best target messages to different cultural or ethnic groups or to different communities, sort of the topic of our workshop? And can you share with us something, for instance, with the Let's Move campaign, or was that not a campaign that was targeted in any specific way?
Sure, yeah. I mean, there's lots of research that focuses on how to reach different audiences.
And does the Ad Council do that?
And we do our own primary research, so we look at a lot of the secondary research. We rely on the expertise of some of the agencies that we work with. I mentioned Burrell Communications and Casanova and Ogilvy, who do a lot of this work in this space and have their own research from some of the for-profit advertisers. And then we do our own primary research. Most of the times it's specific to communications research, so it's not test and control types of studies, but it's helping us understand the right way to reach audiences, what messages resonate. So everything from quantitative online surveys to qualitative focus groups and IDIs. So all of that Let's Move work was tested both to help us develop the right messaging strategy, and then the creative itself was exposed to those various audiences to make sure that it resonated, that there wasn't anything offensive, that it was motivating them to find out more.
You didn't talk about the outcomes, but you said you have tracking data and you know what some of the outcomes were. Were there differences by different cultural or ethnic groups in the success of the Let's Move campaign you had?
Yeah, so there are cultural differences, and we look at that to make sure that the work that we're targeting to different communities is resonating and working. The interesting thing is there's different starting points for each of those audiences. Obviously, one of the things that comes to mind, Lori was talking about this idea that African American audiences are drawn more to advertising that may be targeted to them. And I think that bared out in our research, in that awareness of Let's Move via our campaign was actually higher among African American communities than it was in the general market. We still saw some shifts, but the African American community was more receptive to it, more aware of it.
I'm curious to know if you measured whether the Latino community understood what the concept BMI was after the message about BMI.
We did see some movement there as well, clearly not at the level that we hope. And typically our campaigns will take some time to gain traction and to grow that knowledge and awareness, and we had hoped that it could continue longer than the 2 years. But we did see some movement. The challenge for us, if you're looking at a 30-second commercial, or an online banner, is you have so little time to communicate. So what we typically try to do is to strike a chord, motivate folks to take that next step, in this case, go to the website. And then we typically rely on folks like Let's Move and others to help us understand what that path is beyond that point.
And Laura, you mentioned a number of areas that more research is needed in. Could you pick out the one that you think is most important and elaborate on it. You talked about monitoring more, talked about getting parents to understand the impact of advertising on adolescent brain development,
Right.
looking at effects of these ads.
Right.
Where do we have the least amount of research, and where do we need the most?
Well, that's a good question, Ellen. You know, we need a lot. I think that there's two sides to it. I think as the marketing and our whole media and message environment has shifted and is in this evolutionary state, there's a lot we need to know about not only how kids and families use media, but what those effects are. And the additional research about brain development is extremely important, because I think in all the recommendations that the IOM has generated so far have relied primarily on studies, very good studies of television, that were all about the fact that kids under age 8 or maybe under age 12 didn't really have the cognitive capacity to understand what persuasive intent meant. So that means they can't judge well when they're looking at an ad. It's the same as being told something out of a story or anything else. So they receive the information differently than somebody who has the capacity in their brains to know the difference between that. And we thought that capacity developed much earlier than it does. So we have a combination now of understanding that brain development isn't really settled until kids are much, much older. And at the same time, the media environment has shifted so that the kind of always on and stimulating environment is attracting their brains in a way that we didn't really understand before. So I think that's enormously important, but so I'd put that at the top of the list, but the flip side is that you have to help people understand that too. So we can't keep that only in the hallowed halls of the IOM. We have to take that out to the world and help parents understand that something that just seemed kind of itchy and annoying actually might be harming their families.
So let's move to the question of what can we do policy-wise to really accelerate the issue of trying to reach equity in the message environment. So who'd like to take a shot at that?
I can just say that, you know, the work that we do at the Ad Council doesn't necessarily involve policy, so I can really only speak from my personal viewpoint here. And I think, you know, the recommendation in the IOM report to foster continued funding support for sustained communications programs, I think is one that I know would help the work that we do at the Ad Council and that many others are trying to do. Clearly, you know, Lori talked about, and I think we're all aware of, the amount of messaging out there that is, you know, quote unquote, competing with the healthier messaging that we do. So to have sort of starts and fits and with a lot of these campaigns doesn't necessarily help the communications environment from a positive standpoint. So I would definitely be supportive of continued sustained efforts to support these types of healthier messaging.
And will there be some sustained Ad Council messaging around obesity or physical activity now?
So we are, as I mentioned, our funding will end in June. We're in the process right now of looking for new partners to help us. It's clearly something that we need to continue to have on our docket of issues. So we're actively right now pursuing that avenue so that we can continue to sustain an effort. Fortunately, the work that we just created will probably no longer be able to continue after June, but we'll look for other partners to promote additional messages in a similar vein.
And the one question I didn't ask you is, are most of these ads television ads, or do you do the social media and online as well?
Yeah, and I apologize, you know, the most visual example is TV, but we're in all spaces, so social media, you know, the digital space, we have content partnerships, we do in-school programs, you know, outdoor radio. Basically, we look at the audience, understand where they're consuming media, and try to develop fully integrated campaigns.
Lori.
Well, I think that's a good jumping off point for thinking about how we accelerate progress, particularly around ethnic and racial minorities, because, I hate to say minority, it's not the case anymore, is it? I think we have to look at all 4 Ps. We have to take a systemic approach, and I'm glad that our final speaker in the conference will be about systems, because you can't really isolate the messages. So to answer that question, I think one way to think about it is what's different, and I would start with place. I want to know, what are the messages surrounding people in neighborhoods? What are the products? What are the messages of those products? What are they? What are the prices? All of that in contrast to what the other mainstream messages are. And it's really hard to disengage messages from the actual actions of the marketplace. I think it's easier for us when we're examining these things to pull them apart and look at them closely individually. But when we want to do something about them, we have to put them back together. And that requires a systems approach.
And clearly, the most research has been done on promotion compared to the other activities. Have you run across research that particularly looks, I know there's been some research on the kind of billboard messages in lower income communities or in ethnic communities. But other than that aspect, have you looked at anything that suggests that there are cultural and ethnic differences in not just place and promotion, but some of the other characteristics?
That's a good question,
Price,
Ellen.
for instance?
I think there's a little bit. I think that more needs to be done, though.
Is there anything else that you would like to say as we round out this session? Anything that you didn't get to say? Anything you'd like to promote elsewhere about the Ad Council?
No, I mean, I think the other thing, if you're interested, we do have a kid-targeted program that I wasn't able to talk about, which really does focus on younger kids, ages 6 to 11. And clearly, you need to talk to kids in a very different voice. We created a pretty unique program called The Greatest Action Movie Ever, and it basically involved not only advertising, but the online social media space where kids were able to audition to be a part of this movie, and that audition required them to eat healthy, be physically active as part of the scenes. And then we created a short 6-minute film that Disney XD actually aired, and that is now continuing to be promoted online. So, we're doing innovative work in this space. We're doing, I think, great work in a lot of other spaces for issues in very different communities. So if you have any questions, I'd be happy to talk with anyone who's interested.
And Lori?
I think that if we want that kind of message and those kinds of great images for kids to get seen and to get a fair shake, then we have to call on the industry to change the way it's marketing. Because right now they're taking up most of the space, and they're taking up space with the kinds of messages that are making it harder for people to be healthy.
Thank you. Thank you both till we thank them for their talks. At this time, we're going to take a break until 10 o'clock, so we have about 15 minutes, and then we'll come back for the last session. Thank you very much.